Hi, good afternoon, everyone. So, I would like to welcome you all to a live session from Let's Update Language Academy for OET Reading Module. So, let's just wait for a few minutes for more people to join in. Yes, I can see people joining in. So, Sandra is saying a hi. Hi, Sandra. Yes, good afternoon, Priya. Yes, good afternoon, Victoria. Good afternoon, Anjana. Yes, so I can see more people joining in. Hello, Meera Vishak. Hi, Atulya. Good afternoon, Priyanka. So, yes, we'll be starting our reading session right away. So, yes. So let me just introduce myself. I'm Pooja Vijay Kumar, and I'm here to give you an insight about OET Reading Module Part A. Okay, so now before we start a reading module discussion, I would just like to give you a certain tips and strategies because for those of you who are writing or attempting for the first time, okay, that's going to be useful for you. So let me just tell you something that is the first important point that you need to keep in mind is that you need to practice a lot, okay, because practice makes one perfect, so as you all know. So if that is the first tip I need to give you, or the strategy that I need to give you, because this tip applies to any English exam or any exam at all. In fact, any skill in our lives. So for the OET reading test, practice is important, it is imperative. Okay, the structure and format are different, may be different from the previous OET materials. So it could be different also. So once you get used to it, it is not as scary as you think. Okay, and you need not be so nervous about it, and you can learn strategies to approach each section. So by practicing using sample materials, okay, you will become more familiar and with the part of this test. Okay, and with the right preparation, you know, anything can be achieved, right? So and the next important information or point that I need to give you is that you need to focus on the English. The OET reading module. So the first one, as I told you, it is practice, practice, and practice. So that is going to help you a lot. And the second information that I told you is to focus on English comprehension and not medical knowledge. Okay, so as a medical professional, when you are reading text in healthcare settings, it is easy to get involved in the text yourselves and spending too much of time and your energy in them. So you may disagree with the viewpoints or facts being given in the text and get caught up in this, so think that you should use your own medical knowledge to answer the question. So it is important to avoid this type of a thinking or approach, because this can divert you from the attention away from the task at hand. So and it could lead to confusion and a valuable time being lost. So focus on finding the information that the question requires and not on your medical knowledge. Okay, so that is very, very important. Okay, please keep your knowledge aside, because we are just going to focus on the text and the exam at hand. So you need to just find answer to the question from the information provided in the text. Okay, and that is by using your language and your comprehension skills and strategies that you have learned when completing samples. Okay, so next strategy or tip that I need to give you is to read with comprehension. So do you ever read a paragraph or article, okay, or a magazine, and in the end you realize that, okay, you have not taken any information because you did not pay any attention while you're reading it. So this is a major problem. So we all do this sometimes. Okay, we tend to read something, but then you are not absorbing anything because your focus is on something else or somewhere else. Okay, so this is something that you need to avoid, because the last thing that should happen to you is to read a passage or text all over again and your valuable time being lost. So please avoid it. So when you're reading the text or when you're attending the exam, you need to have your full focus on the reading material, okay, or the exam. Okay, because don't let yourself lose focus. Okay, because if you're going to lose focus while you're reading it, you're not going to absorb anything, and then you will have to end up reading again. Okay, and you don't have that much time to waste. So please avoid that kind of a mistake. And the next tip that I need to give you is that you need to read the instructions properly, okay, before any exam. Okay, even though you might be well aware of the instructions because maybe you have attended it earlier, what if there are some changes, okay, or there are some updates? Okay, so it's always good to read the instructions, okay, again, so that you will get an idea, okay, about the sections, and it's a reminder for about how much time is allotted for each section, or even though you know. Okay, it's just a reminder, so just read the instructions anyway. And then the next strategy that I need to tell you is read the question first. That is very very important. That is, before you read the passage, it's always better to read the question first. Okay, you can look at the text, you can look at the heading, okay, so that you know what the text is about, but then you have to go through the question first. Okay, that is one useful strategy, because if you read the question, you will get an idea of what you need to find when you are reading the text. Okay, so without any idea, if you just go on reading the text and then you come to the question, okay, then you go and find the answer, so again a lot of time is being lost there. So better read the question first and then go to the text for reading it. Okay, and then while you're reading, your main intention or main aim is to find the answer to the question that you have just read earlier. Okay, so that is another strategy that I shared with you. Okay, another one is that you should highlight information. Okay, the headings, the subheadings, okay, or anything that you feel like it is important. Okay, please highlight those kind of information that is going to be very very useful for you. Okay, because the important information, while you read it, when you read it quickly, um, uh, definitely you you might have an idea, okay, what is important, what is not, right? So just uh, highlight or underline what you think is important, and give underline the subheadings or the headings, and also you can write your own headings, okay, subheadings if required. Okay, if the symptoms, if you see symptoms are talked about in a particular set of the text, just write it over there. Okay, symptoms, or diagnosis, or prevention techniques, or cure. Okay, so or the strategies or the steps taken, or the overview, introduction, definitions. Okay, so you can give these kind of headings while you read the text. Okay, now another most important, or the major thing that I need to tell you is, it's a like a reminder that there is no negative marking while attempting the reading subtest. Okay, so that means even if you get an answer wrong, you will get a zero. And it's the same as even if you leave it blank or unanswered, you'll still get a zero, right? So the same as that. So there is no negative marking. So even if you're unsure about an answer, you can make a calculated guess. Okay, because don't leave it blank. Because if you leave it blank, it's definitely going to be a zero. But if you are going to attempt it, okay, by making a calculated guess, if in case you don't have that much of time, or if in case you don't have an idea about the answer, in that case you can make a calculated guess, and what if it could be right? Okay, you could end up getting marks for that. So you can do that because there is no negative marking. Okay, so that's a final resort. Okay, so yeah, that's about it. Those are the main important strategies that I wanted to share with you. Okay, for those of you who are attempting it for the first time, or also for everyone, it's going to be useful. Okay, so now I would just like to share a presentation with you. So that is about the reading subtest and its structure. So basically, the reading subtest is divided into three sections. That is part A, B, and C. And you have a total of 42 questions in the reading subtest, of which part A will consist of 20 questions, part B will consist of 6 questions, and part C will consist of 16 questions. Okay, and you have a total time of 60 minutes, and of which part A, you will get 15 minutes to solve, and part B and C together you will get a total of 45 minutes. Okay, so that is about the time allotted. And regarding part A, so we are going to have a part A discussion today. So about part A, what I need to tell you is, part A will consist of 4 short text related to a single healthcare topic, and it will be followed by 20 questions, and it will consist of matching, sentence completion, and short answer type questions. Okay, So these are the kind of questions that you can expect from part A. And about part A, what I need to tell you is, what is part A about? So it basically assesses your ability to locate specific information from the four short text in a quick and efficient manner. Okay, and that too, like, that is you need to do it really quickly, okay, because you have just 15 minutes of time and you need to crack 20 questions in a matter of 15 minutes. Okay, so that is quite a challenge, but then you have to do it perfectly. So yes, that's about it. So now let's start the discussion of OET reading module part A. So I'll okay, take the material on the screen. So I hope you can see this material on the screen. So this is the topic of a discussion today. From part A section, it's mumps. That is the condition that we are going to deal with. So yes, you have text 1, text 2, text 3 and text 4. Total of 4 text from that section, and then it is followed by a series of questions, that is questions 1 to 7. You can see on the screen. So you should fill in this section with alphabets. It could be A, B, C or D. Okay, that is, there will be questions and you need to identify uh, whether each question or which information is in which part of the text A, B, C or D. Okay, so you need to identify which whether the question or the information from question 1 is from or belongs to which part of A, B, C or D. Okay, that is what you need to identify, and you just need to indicate the section numbers, whether it's A, B, C or D. Okay, so that is about questions 1 to 7, and about questions 8 to 14. Okay, so that will be as you can see on the screen, you need to answer each of the questions with a word or short phrase from one of the text. Okay, so the answer may include words, numbers or both. Okay, so that is about questions 8 to 14. And regarding questions 15 to 20, as you can see on the screen, you need to complete each of these sentences 15 to 20 with a word or short phrase from one of the text. Each answer may include words, numbers or both. Okay, again, so these are the kind of questions that you can expect from part A section. And okay, and so as I told you, you need to read the question first, and then you can read the material. You can just quickly read the material and get an idea. Okay, and then you can solve the questions one by one. Okay, so and regarding cracking which part first, so you have three categories. Okay, three sections of questions. Okay, 1 to 7, 8 to 14 and 15 to 20. So it totally depends on you, like which part you need to attempt first. But as I can give you a strategy which is going to help you solve it quickly. That is, you can try solving questions 8 to 14 first or 15 to 20 first before going to questions 1 to 7. Okay, I suggest you attempt questions 1 to 7 towards the end. Okay, because by the time you solve questions 8 to 14 and 15 to 20, okay, you will get an idea, because those are questions which expect you to write the exact words or phrases from the text. Okay, and that needs a thorough reading. And while you solve questions 8 to 20, you will have a thorough idea about where each information belongs. Okay, which text holds each information. You will get a thorough idea by the time you solve questions 8 to 20. And in case you run out of time, okay, even in case that happens, then you can attempt questions 1 to 7 without even turning back and checking where each information is, because you are going to be thorough with that information by the time you solve questions 8 to 20. So that is a strategy. So you can keep solving the questions 1 to 7 towards the end. Okay, so even if you have just 2 minutes, you can quickly finish questions 1 to 7, because by that time you get an idea, and it doesn't need a thorough inspection or thorough searching for words or keywords or phrases or sentences, nothing like of that sort, because it's it is just asking you for the section numbers. Okay, so that is going to be a good strategy. Okay, so let's just start solving the material. So yes, so let's just read the material. Okay, so if you're solving it, you can go through the questions first and then try reading the passage. Okay, so now we'll just read the passage to get an idea. Okay, so yeah, right, and I shall highlight the information as I go. Okay, just as I told you, as a tip. Okay, we need to highlight important information. So if I come across something that I feel important, I can highlight it, right? So you can do the same. So yes, I'm just going to highlight the information. So mumps, about mumps. Mumps is a contagious viral infection that is most common in children between 5 and 15 years. And so they are talking about it being a contagious viral infection. Okay, and it is going to be most common in children between 5 and 15 years old. That is an important information which I'll highlight. And okay, so and these are the kind of symptoms that they observe. Mumps is most recognized by the painful swellings located at the side of the face and under the ears. Other symptoms, okay, again symptoms. They are talking about symptoms, okay, which will include headache, joint pain, and high temperature. And then they are coming to mumps is a serious disease because it can lead to. Okay, they are talking about why mumps is a serious disease and the information related to that. Okay, because it can lead to inflammation of the spinal cord and the brain itself and the heart. About 1 in 200 children with mumps will develop brain inflammation. Okay, and mumps can damage nerves leading to deafness. And males might get mumps, okay, which is swollen test. This can cause a reduced sperm count but not enough to cause infertility. Women may miscarry during their first trimester. So these are information given to justify why mumps is a serious disease. Okay, so now moving on, we have another heading here or subheading here, mumps vaccination. So vaccination is the most effective way to control mumps. So vaccination, I'll just highlight this information. The measles, mumps, and rubella vaccine. Okay, highlight that information also. That is part of the routine childhood immunization schedule in Australia. It is given as a course of 2 injections. The first injection of vaccine is usually given at around 12 months of age. A second booster dose is usually given at the age of 4. And then we have another subheading, the increase in mumps. So in 1998, concern was raised that there was a link between MMR vaccine and autism. Okay, let's just highlight that information also. And this has been totally disproved, but it did lead to a drop in the number of children having the vaccine. 27% of all mumps cases have been in adults. In Australia, over the past 5 years, these adults have already received 2 doses of the vaccination. The increase in cases might be due to the vaccine not lasting as long as expected. It might also be the rise in mumps virus in the wider community because of reduced immunization rates. Okay, so that's about it. And moving on to text 2 or text B, you get to see another subheading there. How is mumps spread? So mumps is caused by the mumps virus, which belongs to a family of viruses known as paramyxoviruses, and mumps is spread in the same way as colds and flu. Infected droplets of saliva can be inhaled or picked up from surfaces and transferred into the mouth or nose. Mumps spreads rapidly because a person is most contagious a few days before the symptoms appear. So basically, they are talking about what is the cause of the condition, that is it is caused by the mumps virus, and what is the family of viruses which is belongs to. Okay, and yeah, and then it is talking about how it spreads, right? So mumps spreads rapidly because the person is most contagious a few days before the symptoms appear. This means they do not realize they may be spreading the virus. A person is infectious for a few days afterwards too. Anyone who comes in contact with infectious mumps can get mumps unless they have had mumps before or have been immunized. Now, the next paragraph is mumps is so infectious that it is a recognized, notifiable disease. Okay, so I'll highlight that information too. And this means laboratories, school principals, and directors of childcare centers must report all cases of mumps to their local public health unit. A doctor can usually diagnose mumps based on the person's symptoms. So, how do you diagnose mumps? That is the information that I'm going to highlight. Person symptoms and signs alone, a blood test or sample from the throat, urine, or spinal cord fluid may be taken to confirm the diagnosis and ensure the incidence can be reported. And the next paragraph, there is no specific treatment for mumps. Simple medication like paracetamol may reduce pain and fever. Warm or cold places to the swollen glands may provide relief. Drinking plenty of fluids and resting is essential. Okay, so there I will highlight this information that there is no specific treatment for mumps. Okay, and basically it's about treatment. Okay, so about simple medication, also a warm or cold packs, also plenty of fluids. Okay, so these are the information that I feel is of importance. Okay, and moving to text 3 or text C, symptoms of mumps, that is the next subheading that we can see. So let's go through it. Painful swellings at the side of the face, um, in the palatal salivary glands is the most common symptom of mumps. These glands are within the cheeks, near the jawline, below the ears. This gives the person a distinctive hamster face appearance. Okay, so painful swellings, I'll highlight this information, and this is going to give a hamster face appearance. So yeah, and when do the symptoms develop? That is the next part of or information that I'm going to highlight. Symptoms of mumps usually develop 14 to 25 days after a person is infected with the mumps virus. The incubation period. Okay, the average incubation period is around 17 days. Common symptoms of mumps are a general feeling of being unwell, high temperature, discomfort when chewing, headache, joint pain, feeling sick, mild pain in the abdomen, feeling tired, loss of appetite. The face will be back to normal size in about a week. About one third of infected people do not show any symptoms at all, but they can still spread the virus. So you can see common symptoms of mumps here. I'll highlight the subheading there, and then yeah, they are talking about the face that is going to be in of normal size in about a week. Okay, and yeah, and then the next paragraph is about the most common complication of mumps. Okay, and that is and according to statistics, again statistics, they are talking about the statistics here. I'll highlight that information, and yeah, so that they are talking about mumps is usually a more severe illness in people infected after puberty. Severe illness in people after puberty. Okay, and yeah, and then they are talking about the statistics. 7.1% of people aged 5 to 14 experienced additional complications from mumps. Only 3.8% of people aged 25 to 59 had additional complications compared to 15.4% of those aged 60 plus. So nobody in the 0 to 4 and 15 to 24 age ranges had additional complications. So that is about text C or text 3. Now moving forward to text 4 or text D, preventing the spread of mumps. Okay, so that is another subheading or subcategory, and I'm going to read that MMR vaccine is the most effective way to stop a person developing mumps. Okay, so that is going to be another important information. And then another sentence, people born after 1965 need to make sure they have had 2 doses of mumps containing vaccine. Okay, so that's again about it. And then moving forward, people with mumps should. Okay, so what are the steps that they need to take? Okay, so stay away from childcare, school, work, and other places where people gather for 9 days after the onset of the swelling of the salivary glands, and then wash their hands regularly using soap and water, and always use a tissue to cover their mouth when they cough or sneeze, and throw the tissue, and wait till the doctor says they are no longer infectious. Okay, and last sentence, vaccines have reduced the number of cases of mumps internationally, but the rate of mumps outbreaks is increasing. The number of mumps cases does fluctuate. Okay, um, the World Health Organization keeps track of the number of cases by country. In Australia, there have been less than 100 cases in some years since 1997. Between 2007 and 2014, there was an average of 232 cases per year. In 2015, there were 633 cases, but in 2016, 800 cases were reported. In 2017, this rose to 806. That's about statistics. Again, they are telling about number of cases, okay, in different years. Okay, so now we have read the text, so we have got an idea. Okay, so about the information that is included in the text. So now moving towards the questions. So questions, we shall actually crack from questions 8 to 14. So the question 8 is, answer each of the questions 8 to 14 with a word or short phrase from one of the text. Each answer may include words, numbers, or both. Okay, so now let's solve the question. Question number 8. What is the name of the family of viruses that the mumps virus belong to? So please put in your answers in the comment section. Okay, so I can see a lot of messages here. So good afternoon, Shruti. Good afternoon, David. And good afternoon, Binimul Clinto. And good afternoon, Yasir Mohammed. Good afternoon, Karthik. Yes. So yes, hello, Shafna. Hello, Liji. Yes. So now please put in your choice of answers in the comment section. So let's solve the first question. That is the 8th question from the second category or second section of questions. What is the name of the family of viruses that the mumps virus belong to? I think we have just read that information few minutes back. Okay, so name of the family of viruses. Okay, so let's go through the text. So that is definitely not going to be in text 4 because that text 4 is dealing with prevention and techniques. So that is not going to be in text D or 4. Moving to text 3. Text 3 is talking about the symptoms of mumps. Okay, so again, it's not going to be in text 3 or text C. Okay, so now moving to text B or text 2, here we have how is mumps spread, and there we have the very first sentence itself. Mumps is caused by the mumps virus, which belongs to a family of viruses. No. Okay, so we have the answer here. Okay, so I hope you can see this answer. So this is the answer. So I'll just highlight this information, the answers in green. Okay, so that you'll know which is the answer. Uh, that is the answer. So of question number 8. Okay, so moving to question number 9, what is the most common age range when someone gets mumps? Okay, common age range. Okay, I think we have also gone through that about the common age range, etc. So let's see. It's definitely not going to be in the D part because that's again related to prevention. C part is related to symptoms. B part is related to spreading of the disease. So let's go to A. A is covering the introduction of the disorder. So, see, what is the most common age range when someone gets mumps? So, it's going definitely going to be in part A. And what do you think the answer is? Just have a look at it and please let me know the answer. Please put in your answers in the comment box. Okay, I shall read out your answers. Okay, so I can see San essay giving the answer to the previous question. Yes, I just saw it now. Yes, hello Nadia, Sahir, and yes, I can see Twinkle Matthew's answer as well. Okay, please put in your answers for question number 9 as well. Yes, I can see your answers coming in. Anjali Mahazan has put in the answer as 5 and 15 years of age. Okay, and San essay has commented between 5 and 15. Yes, good. So I can see, yes, that is the correct answer. It is 5 and 15. The most common age range is between 5 and 15. So I'll just put in the answer there. 5 and okay, so moving to the next question, what does MMR stand for? MMR, the full form of MMR. Okay, you need to expand it. So where did we see that information? It should ideally be in text A, right? Because text A is including all the introduction of the disorder. Okay, so the expansion of MMR is going to be in part A, right? So where do you think the answer is? Please put in your answer, the full form of MMR. Yes, I can see your answers. Yes, Tingle Matthew had earlier responded to the previous question, and now she has responded to this particular question, and the answer is measles, mumps, and rubella. Yes, for those of you who have joined in late, the question that we have at the hand is what is the full form or what is MMR? And please find the answer and please put in your comments. You put in your answers in the comment section. Yes, I can see San essay has also replied. The answer is measles, mumps, and rubella. And yes, it's indeed measles, mumps, and rubella. That is the expansion. So I'll just highlight that information. Okay. So and we'll put in the information. The information. So now, moving on to question number 11. Which gland swells up around the face if a person has mumps? Which glands swell up around the face if a person has mumps? Okay, so where do you think the information would be? Because I hope you remember we talking about how this phase will be, right? It will swell up and all those stuff. Yes, it is in text 3 or text C, symptoms of mumps, right? The painful swellings and all that. So it is in text 3. So our question is, which glands swell up around the face if a person has mumps? So please put in your answers. They are asking about the glands. Name of the glands. Yes, I have answers coming up in the comment section. San Essay has put in parotoid salivary glands as answer. Yes, Twinkle Matthew has replied parotoid salivary glands as the answer as well. Yes, Anjali Maharzan has replied parotoid salivary glands. Yes, it is indeed parotoid salivary glands, and congrats to all of you those who have answered it correctly. So we'll put in the answer there. Okay, so that is uh, so, and moving to the 12th question, mum spreads in the same way as what two other conditions? So where do you think the answer would be? Spreading, about spreading. So it's not going to be in text D, which is dealing about prevention techniques. Spreading is text, uh, where do you think the answer is? Okay, so it should be, yeah, about spreading. Yes, how is mum spread? You can see the heading also here, right? So, yeah, about spreading of mums. So, where do you think the answer is? So they are asking mums is spread in the same way as two other condition. And so, what do you think the answer is? Please put in your answers in the comment box. Yes, I can see more answers coming in for the previous question. Jissa Jinto, Shiny Reggie, Jomi Mol Benny, uh, all have answered it correctly for the previous question. Yes, I can see answers coming up. Anjali Maharzan has replied colds and flu. Okay, so please put in your answers in the comment box very quickly. So, mom's question is mom spreads in the same way as what two other condition, and the answer should be here in under this heading, right? Okay, so the answer is indeed colds and flu. Congrats to those who have answered it correctly. So I'll just highlight that information in the same way as colds and flu. So I'll just put in that answer over here. Okay, moving to the next question. How many cases of mumps were reported in Australia in 2017? How many cases? Okay, it's dealing with the statistics. So, yeah, how many cases? report in Australia. Okay, so talking about Australia and the year, we had actually dealt with a lot of years in text D, right? Towards the end of the passage, there were a lot of dates, okay, or the years in 2016, 14, 7, 15, 17, etc. So, yes, you have the information should ideally be from this part. Okay, that is text D. So, what do you think the answer is? Please put in your answers in the comment section. Yes, I can see more answers coming in. Shiny Reggie has answered correctly, and yes, please put in your answers in the comment section. Okay, so right, the answer is about 2017 they are asking, and they are talking about Australia here. Okay, all the cases are about Australia. Okay, cases in Australia. So, and in 2017, how many cases were there? And what should your answer be? Is indeed 806 correct? Yes, Anjali Mahazan, Shiny Reggie, 806. It is the correct answer. Twinkle Matthew, you have also replied with the correct answer. Ria Jibin has given the correct answer. It is indeed 806. So it's as simple as that. So I'll just highlight that information as well. Okay. So it is in the last sentence. Okay. Okay. So that is the answer. So we'll put in the answer. Moving towards the next question, at what stage of their pregnancy might a woman with mumps miscarry her child? Okay, so about pregnancy and miscarriage. So, do you remember which passage or which text did we deal with that? That is about miscarriage and pregnancy. It should ideally be in text 1 or text A, right? Because they were talking about mumps being a serious disease, and they cited the reasons why it is a serious disease, and over here they have this information, and you can see the information here. I'll just highlight this information. Okay, this is towards the last sentence of what is mum's under what is mum's heading. That is the last sentence. Women may miscarry during their first trimester. Okay, so that is the answer. So the answer should be first trimester. Okay. Okay. So I'll just put in that information here. Okay, moving to the next question, question number 15. Mum spreads rapidly because a person is dash a few days before the symptoms appear. What do you think the answer is? So, yes, I can see a lot of correct answers coming in for the previous question. That was Twinkle Matthew has replied the correct answer, Anjali Mahazan, Sanesse, Ria Jibin. You have all answered correctly. Congrats. So, moving to the next question. Mum spreads rapidly because a person is dash a few days before the symptoms appear. So, they are talking about the symptoms, right? They're talking about the symptoms. So, this is the key word here, symptoms. So, where do you think the answer would be? The symptoms? We talked about symptoms in which text? Here in text 3, there are a lot of symptoms being discussed. Okay, but the symptoms discussed anywhere else, that is what we need to see. Yes, it is also discussed in part B as well, right? Mumps spreads rapidly because a person is most contagious a few days before the symptoms appear. Okay, so we have an answer here. So please come up with your answers in the comment box and the answer. So, what do you think the answer would be? The question was um, mumps spreads rapidly because a person is dash a few days before the symptoms appear. So, what is the word? This is the sentence, and the word is, contagious is the word. Okay, most contagious a few days before the symptoms appear. Okay, so that is the answer. So I'll put in the answer over there. Moving to the next question. MMR vaccine is the most effective way to stop a person dash. And where do you think the answer would be? Most effective way to stop a person dash. To stop a person, that should be prevention, right? So prevention techniques were talked about in the last part, that is text D or text 4. Okay, and here we have the answer in the very first line itself. um, yes, MMR vaccine is the most effective way. That is the question as well. Okay, so I'll just highlight that information. Okay, MMR vaccine is the most effective way to stop a person developing. Okay, that is the answer. So just fill in that information here. Developing mumps. Okay. Okay, moving to the next question. The most common complication of mumps is most common complication. So, complication. Where is that information? Complication, we have discussed about that information. I think in the symptoms section. Yes, I think in text 3. Yes, you can see this information here, and here it is. So, this is the answer. I'll just highlight that information. The answer. So I'll just put in that information here. So congrats to all those who have answered correctly. Okay, moving to the next question. The measles, mumps, and rubella vaccine is part of the routine dash schedule in Australia. So, what do you think the answer is? So, regarding the MMR vaccine, we have talked about MMR vaccine in the very first part, right? In text A, that is part A. So, we'll quickly move up to part A and search for the information. So, about the vaccine, they are telling, and the question is part of a routine dash schedule in Australia. Okay, we have the correct sentence over here, right? The measles, mumps, and rubella vaccine is, I'll just highlight that information. is part of the routine childhood immunization schedule. So that is the answer. Okay, so I'll just put in that information here. Moving to the next question after that. Directors of childcare centers must dash all cases of mumps to their local public health unit. Where do you think the answer is? Okay, so they are talking about reporting, right? So we did go through that information earlier in part 2 or section 2 or text 2 or text B, that is about reporting. Yes. Yes, mumps is so infectious that it is a recognized notifiable disease. This means laboratory, school principal, and directors of childcare centers must report all cases of mumps to their local public health unit. Okay, so that is the information that is we are looking forward to. So yes, they are talking about childcare centers or the directors of childcare centers and doing so that is about the information that is mentioned in that question, and the information will be over here. The directors of childcare centers. We have got the exact information here. Must report all cases of mumps in their local public health. So the answer is report. Okay, so moving to the next question. So congrats to all those who have answered it correctly. And moving to the next question. Only dash of people aged 25 to 59 had additional complication from mumps. That is a question. So they are talking about additional complications. So additional complication, we did come across that in text 3 or text C, right? So let's go through that text. It's in text 3, right? We talked about symptoms and also complications as well. See, I had highlighted that information earlier on when we got to read it, because we felt that was important, right? So the most common complication of mumps is, yes, then they are talking about the statistics, and the question that they have asked us about how, like how much of people, like how many percentage or a number of people aged 25 to 59 had additional complications from mumps. The additional complication, that is something that they have mentioned here. I'll highlight that information. So let's see about additional complications. So they are asking about 20 people aged 25 to 59. See, only 3.8% of people aged 25 to 59 had additional complications compared to 15.4% of those aged 60. So only 3.8% of people aged 25 to 59. So that is what our question also was. So 3.8% is the answer. Okay, so with that we have completed questions 8 to 20. Now moving to questions 1 to 7. So these are questions that could be solved very quickly, because by this time you are very well aware where each information is, in which section does each information belong to. So you have all and a thorough idea. Okay, so you know by now after solving questions 8 to 20. So now let's solve questions 1 to 7. The number of cases of mumps in Australia. Number of cases, which section was that? Number of cases. Okay, number of cases, we have talked about the number of cases here in text D, right? A lot of cases, right? They have mentioned about cases a lot here. Okay, so the number of cases is definitely from part leaves. Moving to question number 2, the number of cases of mumps among adults in Australia in the past 5 years. Among adults in Australia in the past 5 years. So where do you think the information is? Okay, so in the past 5 years and regarding adults, all those information is possibly from text 1. Here we have this information about adults, right? Yeah, 27% of all mumps cases have been adults in Australia over the past 5 years. You have this information here, right? Okay, so that is the increase under the increase in mumps subheading. You have this information. So this is from text 1 or text A. So we'll fill in with that. And moving to question number 3, what causes the hamster face linked to mumps? So hamster phase, we did talk about that, right? In I think in part B. Part C. Yes, part C, we talked about symptoms and then we talked about pain swellings and then they did mention about the hamster phase appearance. So that is from text C. Moving to the next question, the fourth question, the way the mumps virus is spread. What do you think the answer is? Which section holds that information? The way mumps virus is spread. Okay, spreading. Okay, the spreading was from text B, right? How is mum spread? Okay, so definitely it's going to be from text. Moving to the fifth question, the condition that was linked to the MMR vaccine in 1998. The condition that was linked to the MMR vaccine in 1998. So, what do you think the answer would be? Which text holds that information about MMR vaccine? That was definitely from part A, right? Because we had already solved some questions related to MMR vaccine, and that was from A. So you need not go back and see because by now you're thorough with that information. Moving to the next question. The sixth question, the incubation period for mumps symptoms to appear. The incubation period. Okay. Incubation period was something that we discussed. Yes, in text 3, you have this information here. The incubation period, right? Can you see this information? Here in brackets, in the second paragraph in text 3 or text C. Okay, so yeah, after a person is infected with the mumps virus, that is the incubation period, the symptoms usually develop 14 to 15 days, 14 to 25 days after a person is infected with the mumps virus, that is the incubation period. So that is the answer. So that is actually mentioned in text C. So let's put in that information here and move to the last question. What people with mumps should do? That means the precautions that they need to do or the prevention techniques. Okay, so that is definitely from text D because we know that was the heading of text D. So these are a set of questions 1 to 7. These are going to be very easy to solve, so please keep it for the last. Even if you run out of time, you can still solve all 7 questions. Okay, because these are easier to solve. Okay, so rather than finding specific text or phrases from the passage, these are much easier to solve. So please keep it for the last. So with that, we have completed the discussion of part A module. So now it's time to wind up. So I hope you have understood what we have discussed today, and I hope you have got an idea about how to crack part A. So thank you for joining us. See you next week. Take care.